golden.
I just turned.
Help save a life. Learn CPR. Today I'd like to talk to all of you about the importance of learning CPR. Do I have your full attention? Yes. I want to touch on how important learning CPR is. Hopefully you will never need to use it, but if you should, wouldn't it be great if you knew the correct way? Yes. I will inform you on the difference between performing CPR on an adult and a child. Would you know what to do if your child went into cardiac arrest, Felicia?
No, I would not.
Calling 911 should always be the first thing you do. And immediately performing CPR will greatly increase his or her chances of survival. CPR is a life-saving technique that maintains the blood flow to the brain and to the heart and can help buy time until paramedics arrive with more advanced care. When someone suffers an out-of-hospital heart attack, his or her survival depends greatly on receiving immediate CPR. According to the American Heart Association, less than 1/3 of these individuals receive the help they need because most bystanders are untrained in CPR and are afraid they will do something wrong. That is by Lindsay Hutton. About 92% of all sudden cardiac arrest victims die before reaching the hospital. Did you realize that?
No, I did not.
But statistics prove that if more people knew CPR, more lives could be saved. Immediate CPR can double or even triple a victim's chance of survival. That's according to the American Heart Association. Okay, let's go over what CPR is. CPR stands for cardiopulmonary resuscitation. CPR is a combination of rescue breathing and compressions delivered to the victim thought to be in cardiac arrest. Cardiac arrest is often caused by a normal health rhythm called ventricular fibrillation, or VF. When VF delivers, the heart quivers and doesn't pump blood. We must learn to recognize the warning signs of a heart attack, stroke, and cardiac arrest. Most heart attacks involve discomfort in the center of the chest that lasts more than a few minutes or that goes away and comes back. It can feel uncomfortable pressure, squeezing, fullness, or pain. There may be other signs to look for. Discomfort in the areas of the upper body, shortness of breath. Did you know that, Felicia?
No, I didn't.
May break out in a cold sweat. Did you know that, Kelsey?
No.
Or have lightheadedness or nausea. Bonnie, did you know that?
Yes.
Very good. Signs of stroke to look for include numbness or weakness in the face, arm or leg, especially on one side of the body, confusion, trouble speaking or understanding, trouble seeing in one or both eyes, trouble walking, dizziness, or loss of balance coordination. Did you know that, Matthew?
No.
Severe headache with no known cause. Cardiac arrest warning signs are sudden loss of responsiveness, no normal breathing, also no response to tapping on the shoulder. Each year, almost 330,000 Americans die from heart disease. Heart disease is the #1 killer in the United States. Malaysia, did you realize that?
No, I did not.
Because of up to 80% of all cardiac arrests happen in the home, you are most likely to perform CPR on a loved one or a family member. CPR is one link in what the American Heart Association calls the chain of survival. The chain of survival is a sense of action that when performed in sequence will give a person having a cardiac arrest, heart attack, the greatest chance of survival. The following are what the American Heart Association recommends. Early access. This means activating emergency medical services or EMS systems by calling
911.
911. Very good. The next link in the chain to perform CPR until defibrillation becomes available. If available, early defibrillation becomes the next link in the chain of survival. Once the EMS arrives, The next link in the chain of survival is early advancement life support care. This involves administration medication, using special breathing devices, and providing additional defibrillation shock if needed. Now, let's go over what to do when a person develops cardiac arrest. The heart stops beating, there's no blood flow to the
Brain.
or
The
heart, very good. With no blood flowing to the brain, the person becomes unresponsive and stops breathing normally. When you discover a person who you believe is experiencing a medical emergency, the first thing you need to check for is responsiveness. What would you do?
Take their pulse.
Call 911.
Check their shoulder,
Tap them.
tap on their shoulder and say, "Are you okay? Are you okay?" If the victim is unresponsive, immediately call
911.
Yay! 911. Or if there is someone with you, you have them call 911. If an AED is available, bring it back to the person's side and follow the directions. If an AED is unavailable, you need to do rescue breathing. You do this by first opening the person's mouth, airway. Tilt the victim's head back by lifting the chin gently with one hand while pushing down the forehead with the other hand. Next, place your ear next to the victim's mouth and nose and look, listen, and feel. Look to see if the chest is rising, listen for any sounds of breathing, and feel for any movement on your cheek, taking no more than 5 to 10 seconds if you don't see, hear, or feel any signs of normal breathing. You must breathe for the victim. While keeping the victim's head tilted back, place your mouth around the victim's mouth and pinch the victim's nose. Give 2 slow breaths, making sure the person's chest rises with each breath. After giving 2 breaths, begin chest compression. Place the heel of one hand on the center of the chest, right between the nipples. Place the heel of your other hand on top of the first hand, lock your elbows, and position your shoulders directly above your hands. Press down on the chest with enough force to move the breastbone down about 2 inches. Compress the chest 30 times at the rate of about 100 times per minute, slightly faster than one per every second. After 30 compressions, stop, open the airway again, and provide the next 2 slow breaths. Then position your hands in the same spot as before and perform another 30 compressions. Continue this cycle of 30 compressions and 2 breaths until AED becomes available or until medical personnel arrives. This technique of CPR may be used on anyone older than
30.
No.
5. 1.
No.
50.
8. Next, you will go over CPR in children. Cardiac arrest is less common in children than in adults. It usually happens when there is a lack of oxygen caused by near drowning, respiratory infections, or choking. CPR on a child is performed for 1 minute before activating the EMS. This may reverse the lack of oxygen and revive the child. Doing CPR on children ages 1 to 8 is similar to doing it on adults. However, there are some minor differences. Most are due to the child's smaller size. When compressing the chest, the heel of only one hand is used instead of 2 hands, and the chest is pressed down about 1/2 its depth. Performing 5 cycles of 30 chest compressions followed by 2 breaths, then use an AED to elevate the heart rhythm if available. If an AED is not available and the child is still not breathing, normal coughing or moving, continue cycles of 30 compressions to 2 breaths until help arrives. One more thing I'd like to touch on is infant CPR. An infant is defined as a child younger than 1 year of age. Because an infant is smaller than a child, the CPR techniques for infants contains further change. Smaller breaths are given, enough to just get the chest to rise. Only 2 fingers are used to compress the chest down about 1 inch. Otherwise, the CPR sequence is the same as for a child. One last thing before I let you all go. I just want you to know that this is a reference. It's only intended to serve as a guideline for learning about CPR. This is not intended to be a replacement for a formal CPR course. Thank you. Get the audience one more time.